Hello, Scott McFarland. This is my video response for the Intro to Addiction Studies midterm. So I'm going to be reading off some notes also. So I'm going to switch my camera real fast to my note just to kind of show you a little bit of the notes I have and everything. So you know when I'm kind of looking to decide what exactly I'm looking at. So we're going to start out with case management, something I'm very, very comfortable with, something I do a lot in my day-to-day career. Primary role of case management is simply management of cases. That's kind of what it sounds like. I have 30 to 40 clients a month that I work with, and a lot of what I do is case management. What they need, the services they need, I need to give them, so forth. Let's see. Comprehensive assessments. That can be anything from ACE scores to CAN scores to basically just everyday assessments of my clients. I work with a lot of kids, so I do a lot of ACE, and I do a lot of CANs, children and adolescent needs and services is a CANS score. So the next one we're going to talk about is treatment planning. Treatment planning is simply what we're going to do for that client, what we're going to do moving forward, the steps we're going to take to help this client reach the goals they want to have. Coordination of services, whether that be state, county, local, government agencies, far northern regional centers, homeless shelters, kind of stuff. Everything that we do together is a coordination of services where I can go to individual companies and talk about the kind of stuff they're going to need to be better and get the services they need. Referrals, again, far northern regional centers, job placements, smart centers, Medi-Cal, Medicare, that kind of stuff. Referrals to different organizations so people can get the services they need. Advocacy. I'm big on advocacy. I want my clients to get the best care they possibly can have. So that I'm going to fight for them a lot in courts, in rental history, rental places, and jobs. I want to make sure that people get the best services they can, and I'm going to advocate for them to get those best services that they can. Monitoring and follow-up. How are my clients doing? If I haven't seen them in 6 months, 7 months to a year, I still have them in my book sometimes. I'm still going to follow up and make sure they're doing okay as far as treatment, as far as rehabilitation, as far as housing and jobs and security. Knowledge and medications for addiction treatments. Medications for addiction treatments combine FDA approved medication with with counseling to treat opioid and alcohol use, reducing cravings, withdrawal symptoms, and overdose risks. Basically, opioid blockers, treatments, alcohol treatments. I'm not big on medication for alcohol, but I know they exist. But the biggest thing I know is opioid treatments, receptors. Use medication for NXT. What medications are used for what disorders? Methadone is a big one for addiction. And Malatrix is one that we use in the field a lot. Methadone is a big one. Controversial, of course, but methadone is the biggest treatment for opioid addiction. Let's see. Potential side effects: nausea, constipation, heartburn, upset stomachs, headaches, sedation are all unfortunately kind of side effects of the treatment for opioid addictions. And again, I'm reading this I did write my notes. I'm going to kind of read myself this also. But the big ones are nausea, vomiting, upset stomachs, indigestion, a lot of gut stuff, a lot of stomach stuff that unfortunately goes hand in hand with methadone treatments. Breakthrough therapy. In the mid 2020s, actually mid 12, sorry, to expedite development of renewal review of drug designed to treat serious conditions based on preliminary clinical evidence, including indicating substantial improvement over existing therapist success rates. Bad cough. Basically, successful therapy. Breakthrough therapy is successful therapy, in my opinion at least. Let's see. Dual diagnosis is a mental thing and a physical thing. Usually it's mental condition along with an addiction of some kind. We call that a dual diagnosis. Alcoholism and schizophrenia, drug abuse and ADHD or PTSD. It is a mental and a physical thing. Morbidity, the situation and presence of two or more diseases or medical conditions in the patient. Comorbidity, it's like if you have drug addiction and alcohol addiction, if you have schizophrenia and autism, if you have DAD and PTSD, these are comorbidities. Basically, you have more than one thing of the same type of thing. Two mental health conditions, two physical conditions. That's a good one. Managed versus unmanaged disorders. Until you have a diagnosis, you cannot say you are autistic. You cannot say you have ADHD. You cannot say you have this thing. Even if you think and you know you do, until you are officially diagnosed by someone like me or a clinician, better sounding, you cannot claim any kind of diagnoses. And you might know you have it, but you cannot claim it until you are officially diagnosed with it. Most common mental health disorders. I'm going to read this because I wrote them down, but I'm going to read this off the list. There are 13 of them. Generalized anxiety disorder, major depressive disorder, ADHD, behavioral disorder, social anxiety disorder, panic disorders, PTSD, phobias, bipolar disorder, eating disorder, substance use disorder, specialized anxiety disorder. Those are the basic top 13 to 14 things that people are treated for. Someone goes in office, that's probably what they're going to be treated for, one of those things. Clinical documentation. Oh, my absolute favorite. Love it. I'm very, very bad at documentation, but in the industry, if it's not documented, it didn't happen. That is a line that we use all throughout the field. If it's not documented, it didn't happen. The purpose of documentation is simply to let the government or facility or somebody know what happened. That is the purpose of documentation, pure and simple. Formatting types. I have worked in a few different companies that have very, very different definitions of what they want reported. I worked at one company, they wanted 2 or 3 lines that was very, very specific, that was very, very clinical based, and it was sent to the government. If you weren't in the industry, it'd be very hard for you to understand these notes. I've had other companies really want page after page of a daily activity that is very, very easy to read, but not very clinical, not very specific to a certain type of treatment. So there are very extreme forms of very, very official to very loose based. Clinical language shorthand. I'm bad. I'm very, very bad at the shorthand, the clinical language, client and teach, and the words that we have wanted to use in the past, I'm really bad at. I admit it, I'm not a good note taker. I'm not a very good clinical writer, and it is something I know I need to focus on better in the future. Let's see. 42 CRP Part 2 HIPAA is the laws protecting patients receiving treatment. It is above HIPAA. It is above HIPAA levels. Can't talk about anything essentially. There's really nothing that we can talk about. What kind of treatment someone's receiving. I don't even like to use names. I use initials when I'm talking about clients. So, diagnosis criteria is the World Health Organization's guidelines essentially to what a diagnosis is. Level of knowledge of American safety of addiction medicine, criteria and continues of ASAM levels of care or other similar criteria simulation to the department. Basically, a level of care. There's 0.5, early intervention, 1, outpatient, 2, intensive operations, patient hospitalization, level 3, Residential care, or a level 4 is medically mandated intensive care. That is rare. A level 4 facility, if human ready, are rare, but they are important. They are not by choice. They're a lockdown facility usually, and they're the most extreme of the most extreme. So that is kind of my quick walkthrough of kind of the stuff I know about, my day-to-day knowledge about a clinical worker. I hope this kind of meets the criteria you're looking for. And again, I did read some notes here. I'm going to put back one. Look at the notes I read. This is a Word document. The bolded stuff is the kind of stuff I wrote my notes on a little better. But this is a Word document. Just going to minimize it to show you. Yeah, this is a Word document that I wrote out by hand. And I hope this meets your criteria. Thank you and have a good day.